Good morning, members of the media and those joining us online. It is great to have you joining us today for our weekly press briefing. If the questions sent in yesterday was any indication of how today is going to go, I say it's going to be a very, very exciting one. We do have the Prime Minister who is going to give an address today and address many of your concerns, things that have been in the media all week long. Right now, I'm going to invite our press secretary to come, who's going to give you a brief overview of what the day is going to look like. We do have health officials in the room to answer any questions that you may have. As you know, COVID-19 is one of the most topical things that we have been discussing all week long. So please welcome Press Secretary Clint Watson.
Good morning, colleagues, and thank you. Happy holidays to all of you joining and to all of you who are here. We are indeed happy to have all of you here. Christmas is a few days away, and hopefully we're all able to have some form of celebration or at least gathering with our families, small groupings, to celebrate this occasion. No doubt it's been a tough year for everyone, and indeed we want to be able to wrap up the year with some level and some degree of joy. We have a couple of things that we want to discuss on today's agenda. We're going to try and keep it as brief as possible for you all, as we are indeed aware that this is the holidays. Many of you, no doubt, may have some shopping that you want to get to, that you want to be able to do and be with people, and so we understand that. We are very mindful of that this morning, and so we won't keep you long. We do have two small food businesses that we want to highlight today, that we will be highlighting. We'll be highlighting the New Duff and, of course, the Curry Stop. So it should be an interesting treat for all of our media colleagues who are here today as we continue our weekly highlights of businesses, food businesses in the country. And hopefully you've been enjoying them and you've been appreciative of them. And so we're happy that we're able to highlight businesses, what's going on in the communities, and what is actually happening. I think it's important to say a couple of things which will premise my remarks this morning, and that is that the Davis-Cooper administration is working extremely hard to address a number of outstanding issues, a number of issues we've committed to, particularly in the first quarter of the year. And we believe that is essentially important, the first quarter of the term of office. And we believe that's essentially important. And you will be hearing in a couple of weeks an update on exactly where we are, the Davis administration, things that are expected to happen and come on stream and online. And no doubt we'll give that to you. But I want to get right into the main focus of our press conference today, which is to give you an update on where we are with the fight of COVID-19, particularly given what's happening worldwide with the latest strain. And of course, we will have that for you. But it's important to give you a couple of announcements, and that is around 11:30 last evening, Prime Minister Philip Davis was placed into quarantine. And this was following an exposure to COVID-19 from a close family member. As a result of that, the Prime Minister is working from a place of quarantine. He is in good spirits and is indeed in good health. You will hear more about that in a few seconds as we give you more information on that. But you do want to hear what's happening with the COVID fight, and Prime Minister will still deliver that address from his place of quarantine. We will go live to him now so that he's able to address us on the state of quarantine, the state of COVID-19 preparedness. Once he's done with his address and a statement, Dr. Darville, the Minister of Health and Wellness, as well as his team of medical professionals, the acting chief medical officer and other officials from the committee are here to take questions regarding COVID-19, questions surrounding Prime Minister Davis. They will take all of those questions for you here to the media who are here in the media center. So without further ado, we take you live now to Prime Minister Davis for his national statement on COVID-19.
Here we go, Summer. Good morning, ladies and gentlemen. As you all know, tomorrow is Christmas Eve, and I extend to all of you my warmest holiday wishes. I wish I were here today only to wish Bahamians a Merry Christmas and to share our plans for 2022. Unfortunately, I have a different task this morning, which is to let you know that we are looking at a few extremely difficult weeks ahead because of the Omicron strain of the COVID-19 virus. I'm going to share with you where we are now, the steps the government is taking, and the steps that you can take yourselves. For many weeks, we have had a relatively low number of cases. We've also had an extremely successful 2 months in our tourism industry. In fact, record-breaking numbers of visitors have brought a much-needed boost to our economy. In the last few days, however, the number of COVID cases in the Bahamas has increased substantially. Much of the world is struggling with a new COVID variant. The Omicron strain, which is extremely transmissible, the virus can now jump from person to person very quickly. Although this very contagious new variant was identified just a few weeks ago, it has already become the dominant strain in many countries and is causing skyrocketing cases, including in our own neighbor, the United States. Let me give you an example of what Omicron can do. Puerto Rico is now recording a daily average of nearly 1,100 cases, a 762% increase from 2 weeks ago. They've recorded more cases in the past 7 days than during any other week in the pandemic. That is what exponential growth can look like, an explosion of cases. We have sent samples from positive cases here in the Bahamas to a specialized lab to confirm that Omicron is here in the Bahamas, and we'll have an answer very soon. But we are assuming that it is already here, and we are acting accordingly. Let me tell you why we are making that assumption. We recorded 26 positive cases on Monday, 73 on Tuesday, and 140 on Wednesday this week. As serious as recent developments are, there are some good news. New data shows that Omicron does appear to cause more mild disease than earlier strains of the virus. A smaller percentage of people may become seriously ill. However, because it transmits so easily, we are talking about a smaller percentage of a much larger number of cases. For that reason, Omicron is already overwhelming hospitals across the world, including in many states in America and many countries in Europe. Many places are reporting the highest daily totals of cases since this virus began. Countries around the world are pursuing new strategies to contain the worst impact of the virus. We need to do the same here now. The number of cases here is likely to go up quickly and substantially. I'm going to tell it to you straight, because Omicron is so contagious. We could be entering the worst phase of the pandemic. We must do whatever we can to reduce the total number of infections. We want as few of those infections to cause serious illness as possible. And we want to reduce the impact, which unfortunately will be severe, on our clinics and hospitals. I've been working with the Minister of Health, Dr. Michael Darwell, to consult a variety of experts and professionals, and as a result, we are adopting a number of steps immediately. Please understand that the situation is fluid, and we will continue to adapt and make adjustments to our nation's strategy as needed. We have acquired hundreds of thousands of medical-grade masks and intend to distribute those in communities across the country in the coming days. COVID is an airborne disease. Infectious particles of the virus can hang in the air for hours in indoor spaces, and therefore the right mask can and do make a big difference. We are also implementing new rules at the borders. We are changing the requirements for entering the country. Bahamians and visitors must test negative within 3 days of entering the country instead of 5. And beginning on January 7th, a negative PCR test will be required for all. Rapid antigen testing remains a critical tool, but a PCR test is more sensitive and can pick up an infection earlier in its course than the antigen tests. Effective immediately, we are changing the rules about the size of gatherings that are permitted. Indoor gatherings should not have more than 20 people. Outdoor gatherings no more than 30. We are going to increase outreach so that adults who are vaccinated receive a booster, as the booster appears to offer substantial additional protection from serious illness. We are also making concerted efforts to reach those who are not yet vaccinated at all. But unfortunately, it will take weeks for those just now receiving first shots to have the protection that the vaccines confer. It is still important because COVID will still be circulating in several weeks. Our vaccination efforts will include outreach in inner city communities and to undocumented migrants who may have struggled with online registrations or access to vaccine venues. We will also be taking new measures to provide technical guidance to businesses, churches, and others so that these spaces can be made as safe as possible. Because COVID is airborne, ventilating indoor spaces and filtrating the air when possible can make a big difference. We continue to progress as quickly as we can to make COVID testing free. Requests for proposals will be sought imminently before we swiftly move to confirming a vendor who can meet the standards which are essential for this program to work well. We are also taking steps to enhance our ability to respond to infections that require treatment. We are ready to mobilize multiple field hospitals, which should the number of hospitalizations grow. In New Providence, we are planning to utilize the nursing school and the National Stadium, and we are in discussion with an international partner to open a field hospital in Grand Bahama. We are identifying additional options in the Family Islands. Plans include the provision of equipment necessary to support the delivery of care to patients with moderate to severe symptoms. We are recruiting additional nurses and hospital staff. We are working to build partnerships with multiple international non-profits. There is very hopeful news about new treatments for COVID, and we are working to purchase new medications that can be effective at reducing the severity of the disease. Because there is very high global demand, we will be competing with many other countries to obtain them, so we cannot forecast today the precise date we will have access to these treatments. We also want to reduce the negative impact that a surge in COVID cases has on routine health services. The South Beach Health Care Center is being prepared so that those services can continue even as we deal with this new wave of COVID. We will in the coming days also launch a new public education program to empower Bahamians to keep themselves and their families safe, and to combat the misinformation that continues to spread on social media. Minister Davo and the members of the health team will provide greater detail about our plans in a moment. But I wanted to provide this update myself because I want to underscore how serious this moment is for our country. I have just described a multifaceted plan, the implementation of which requires building a coalition of partners. We will be working with healthcare professionals, the COVID Enforcement Unit, the Royal Bahamas Defense Force, the private sector, and multiple international partners. The final and most important member of this coalition is you, the Bahamian people. We are all in this together. Everyone is ready to put COVID behind them, especially during the holidays. It has been an extremely difficult few years, and we are ready to relax and celebrate. Unfortunately, the virus has changed, and so our behavior must change too. I want to emphasize that activities that were relatively safe just last week are no longer safe. That is how quickly things have changed here. We all need to adjust our own thinking about what risks are acceptable, and we need to do so quickly. It's important to understand that vaccinated people are at much, much lower risk for experiencing severe disease. But vaccinated people can still catch and spread Omicron. Some vaccinated individuals who are infected will have no symptoms. Some will have mild symptoms, and some will even have serious cases. And just as vaccination reduces but does not eliminate the chance you will contract the virus, prior infection also does not provide full protection. Omicron has shown that it can infect those who have had COVID in the past. Unfortunately, I can offer you an example from my own personal experience. Last weekend, we had a family gathering, which included several family members who traveled here from abroad. Even though everyone was vaccinated and everyone tested negative before travel, several of those who were visiting from abroad tested positive on the 5th day after arrival in the country. Since then, my wife and other family members have tested positive. I remain negative. Because they were vaccinated, they are either asymptomatic or are experiencing only mild symptoms. I'm so grateful that that is the case. But I know that many of our Christmas gatherings will include both vaccinated and unvaccinated family members. Here is what I'm asking you to do. Please plan those gatherings with your most vulnerable family members in mind. That means the elderly, or those who are diabetic, or those who are immunocompromised because of cancer treatment or other conditions or treatments. Remember that our children under 12 have not yet been vaccinated. Plan your gatherings with the goal of protecting these family members. Outside is safer than inside, always. The virus particles can hang in the air inside for hours. We are blessed with beautiful warm weather, and the forecast for the week ahead is for sunny skies. So here's the best advice from medical professionals and scientists. Avoid large gatherings. Outside is always safer than inside. Limit your time indoors to the extent possible. When you are inside, open as many windows and doors as you can to reduce the number of virus particles in the air. Wear your masks. The government will be distributing medical-grade masks. If you already have one, now is the time to switch to using it at all the time. If you don't have one yet, use 2 masks instead of 1. Double masking can help. If you are vaccinated, get your booster shot. If you are unvaccinated, you are at serious risk. Please do what billions have done safely worldwide and get vaccinated. If you have a cold or flu symptoms, please get tested and do not go to work or gather with others. I wish I didn't have to deliver this news before Christmas Eve. I told you earlier that members of my family have tested positive. I've taken multiple tests over the last few days, and all the results have been negative. I still need to do the responsible thing and self-isolate according to the rules. Being apart from your family is not easy, and it is especially difficult during Christmas time. But the most important part of being in a family is taking care of each other. Let's all take care of each other in the coming weeks as one big Bahamian family.
Okay, that's Prime Minister, the Honorable Philip Davis, giving us the latest with COVID and what the country is doing. Joining me now, we do also have the Minister of National Security, who will come in a few minutes to give an update about enforcement and how police will be enforcing events that have more than the allowed amount of people or events that encourage large gatherings that have not been approved. But before he does, I'm going to invite
outlaid by the Ministry of Health, and I would like the Bahamian people to know that his family members and his loved ones are doing well in isolation and quarantine at various places. With that being said, I would like, first of all, to thank my medical team, as well as the Minister of National Security, to be here today with me, and to say that early next week, the Ministry of Health will be having a full detailed discussion about where we are in the pandemic and all of the statistical analysis as they come in, because this is the third day, and many of our workers who are involved in health are analyzing the data to make the necessary determinations so that we can better serve the community and the medical community while we are in this fight with COVID-19. A couple days ago, 200 plus samples was sent to a diagnostic lab in Panama. Those samples are being assessed for gene sequencing to determine whether the Omicron virus is in country. But I want to say this very clearly. After reviewing the data for the last 3 days and the infectivity as well as the rate of transmission, we are convinced without the gene sequencing that the Omicron virus is more than likely in the Commonwealth of the Bahamas. Yesterday, we had 136 cases positive, 2 in Grand Bahama, 1 in Abaco, 1 in Eleuthera, which is a total of 140 cases. I want to speak a little bit about the vaccination effort because to date, there has been 300,000 doses of vaccine administered to the Bahamian population. The figure includes 8,734 booster shots. And of the close of the business day yesterday, there was 154,804 fully vaccinated persons in the Bahamas. 11,038 of these persons were between the ages of 12 and 17. Those of the 154,804 persons translate into 48% of the eligible population being vaccinated. With that being said, we are now beginning now to improve the rate of vaccination throughout the country. And over the next few days, we will be adding additional centers to begin to bring those individuals to the forefront to receive their booster shot, first or second jab. With me today, we have Dr. Bartlett, we have Dr. Moxie, acting CMO, Dr. Swan, as well as Dr. Forbes here today to answer questions as it relates to the Prime Minister's address. I want to say again that next week, early, the Ministry of Health will be having our own press conference to update the nation of where we are with the Omicron virus and where we are in country. Statistical analysis around the world has confirmed that in most countries, about 80 to 85% of the COVID-19 cases are associated with the Omicron virus. We believe that our picture would be very similar, where the bulk of the virus will more than likely be Omicron, but we must take into consideration that the Delta variant still exists. And so now, with those few words, I'd like to open the floor for questioning, and I'll take the first question from
Dr. Davo.
yes.
Krishna Russell from the Tribune newspaper.
Thank you.
It's a twofold question. So with the cases exponentially increasing over the last few days, one, will this at all hinder the opening of schools? And two, do we yet know when we would get the child doses of the vaccines?
Well, your first question is, we're very concerned about what we're seeing in the country. And over the next few days, there will be a determination what direction we would take. As we said before, the circumstances is very fluid. If we looked at the case in Grand Bahama, there was a spike
and now it seems as if it's tapering off. So we're watching it very closely, and we're watching our tertiary facilities, the Rand Memorial Hospital, as well as the Princess Margaret Hospital. And yes, we are seeking the possibility of having the child dose of the Pfizer in the country as soon as possible.
The Prime Minister was at Cabinet on Tuesday. I see you're here. I see the Minister for National Security is here. Is there any need for the Cabinet to quarantine, given that the Prime Minister is quarantined and he was exposed?
Well, the Prime Minister was exposed by members of his family who subsequently became positive. Because the Prime Minister is not positive, the contact tracing now focus on the epicenter, which is the family, and those who have been associated with the family. The Prime Minister has had multiple tests. Those tests are negative, and so as we stand right now, there's no need to quarantine the Cabinet.
Outside Cabinet, we had asked you about these large gatherings and the concern that people are in groups without masks. Given the fact that what has happened even in the last 2 days with these cases jumping, I know that there are events planned over the next few days. Some of them, I guess, got the Ministry of Health's approval. Are there plans to go back and look at these events and maybe take away some of the privileges from the Ministry of Health to have those?
Well, our Chief Medical Officer and our emergency team looked at events prior to the spikes. I must say that there are few events that have been proved prior to what we are seeing today. And I would allow the CMO, the acting CMO, to say a few words as it relates to that. And then I would also allow the Minister of National Security to speak specifically about the enforcement modalities.
Good morning. Thank you for your question. So as Minister mentioned, we would have reviewed several events last week in preparation for this week's approval, and again, some yesterday. The reality is we have, and we've been expecting this increase, so we've considered the challenges that may arise as a result of this Omicron virus, and we've put things in place to ensure that there is some management or some protocols that we strongly adhered to. One of the things that we did put in place is that these events should be approved by the police force, or ensure that the police force has the capacity to do the necessary policing and protocol monitoring to ensure that the least amount of transmission or risk of transmission can occur.
So those events that were pre-approved to this morning's press conferences will still be allowed to happen, the ones slated for this weekend?
We don't have the final determination as to whether those events occur. We refer to the health protocols and whether or not they can be adhered to. The final approval comes from the police force, who has a determination of whether or not they're able to support the recommendations that have been placed forward by the Ministry of Health, as well as the indications from the vendor or the person sending in the request of their ability to adhere to those protocols.
Any other questions for Mrs. Smith?
Is it likely that health officials would recommend tightening of restrictions at this point?
Sorry.
Is it likely that health officials would recommend tightening of restrictions at this point?
Well, we've had a conversation with the Cabinet, and we've come to a conclusion. I think the restrictions, the recommendations that we have made are reflected in the revised health services rules that should be out, if not today, should be out shortly. Thank you.
Thank you, sir.
Minister, could you come and speak specifically to the second part of her question in terms of enforcement?
Morning. Let me say firstly that the first line of enforcement of any law is compliance with it. If everyone were to decide to commit an armed robbery, then clearly we couldn't police that. If everyone were to decide to commit a murder, then clearly we couldn't police that. This is a law that is designed to protect you. And so the first step in assisting us in enforcing it, as the Prime Minister said, is for you to be compliant with it. With regard the approved events, there's a two-step process, as the CMO has said. The first is that you require approval from the Ministry of Health, who will set out the protocols that you are to follow. As the police are responsible for enforcing the law, if it is a commercial event, you will require an occasional license from the Royal Bahamas Police Force. I can tell you, having spoken to the Commissioner and ACP Dames this morning, that you will not get it if you do not satisfy them. One, that you can comply with the protocols, and two, if you don't commit to providing security that will be provided by the Police Staff Association in their off-duty officer regime. And that will mean that you will be made to hire a police officer who will write you a ticket and close you down if you're non-compliant. This is very serious business. And if you want to make money from the public, you're going to have to follow the rules. And so you might as well budget for having proper security now.
Anything else for the National Security Minister?
Thank you so much. I also would like to invite to the podium Dr. Moxie before taking your question, because the issue of the new rules, which will be gazetted hopefully sometime today, will clearly outline the way forward for large events and social gatherings. Dr. Moxie, please.
Good morning to all. As Minister would have indicated, the Ministry of Health, in collaboration with the Office of the Attorney General, we have been working to revise the health services rules, the ones that will be gazetted either today or certainly by the end of the week, seeks to put in additional parameters for social gatherings, mass gatherings. They will speak to the requirement for vaccination and or COVID-19 testing for participants at those events. It will also seek to differentiate between the limitations, the numbers on persons who are able to gather in indoor settings versus outdoor settings. We're also seeking to ensure, again, as has been said, both by the Prime Minister, by Minister of Health, Dr. Darville, that all of this begins with a certain level of personal responsibility. We have seen the numbers double in less than a 24-hour period, and certainly with these new rules, we certainly would require and need there to be personal responsibility on behalf of every Bahamian citizen and every tourist that comes into our destination. Thank you.
Thank you.
Everyone is talking about the Omicron variant, which is more contagious, but less aggressive. We have, in the last couple of days, lifted a travel ban on Africa, where that strain has emerged, and we have lessened the time for tourists coming in to have those tests done. Does this represent a change in the way the world views travel and COVID-19?
Well, this administration came to office under the premise and said to the Bahamian people that we have to learn to live with COVID, and we need to strike an equilibrium or balance on how we manage COVID and how we manage the economy. What we have been doing And I think we've been doing an excellent job in managing both, because you would see that in our protocols, we were able for the CDC to go from level 4 to level 3 to level 2. That's not by accident. That is by planned strategy to work with international organizations to prove to them that we have the capability to police ourselves, we have the capability to manage COVID, and we have the capability to do it in a very strategic and planned fashion. That was going extremely well. And then now, the Omicron virus, which has completely changed the way on how we need to adjust our protocols. We believe, based on the scientific evidence or information that's coming to us, that we have a plan. The Prime Minister alluded to some aspects of that plan. One of the good things in the midst of the Omicron virus is that the symptoms and the pathogenesis of the illness is milder, which we are hoping would not be a great strain on our tertiary healthcare facilities while we go through a massive educational program to convince the Bahamian people that the way out to stay healthy is to get vaccinated, and the way out to ensure that our economy continues to rebound is to get vaccinated, and to be responsible and to protect yourselves and the general public by executing the appropriate protocols. We believe that the Bahamian people partnered with us up to this point, and I am confident that once the control mechanism is in place for large gatherings, as outlined by the Minister of National Security, I believe that we can find the equilibrium necessary to allow our economy to continue to grow while protecting the lives and livelihoods of Bahamians throughout our archipelago. We understand the pathogenesis of the virus. We understand the science, but it's our job at the Ministry of Health to work closely with the Ministry of Finance and our other government facilities to ensure that we find the right balance that protect lives and the economy to thrive. This is very important for us, and it's a part of our mandate. We're asking every Bahamian throughout the Commonwealth of the Bahamas to join with us. The world is watching us. We have the capability. We have the wherewithal. We have the professionals in our country where we can be able to strike this balance. And I'm asking everyone here and throughout our country to join with the Ministry of Health and this Progressive Liberal Party government for us to plot our own course and our destiny to allow our economy to function effectively while at the same time protecting our loved ones and health and well-being. I could tell you, the Ministry of Health is putting the necessary programs in place to be able to protect people who require healthcare services. That is being done as we speak, and more details will be given next week when the Ministry of Health has its own press conference.
Minister, I know you said the Ministry of Health will have its press conference next week. Can you provide any insight into what the COVID trends are looking like? We saw a recent uptick in hospitalizations in Grand Bahama, and we're seeing the surge. Can you provide some insight into what's...
Yes, Grand Bahama. I have had an in-depth discussion with Dr. Bartlett, Frank Bartlett, who leads the charge in Grand Bahama. We did see an increase in hospitalization a week ago that he believes, and the team in Grand Bahama believes, it may be associated with the Omicron virus. What we saw was many people who eventually was in hospital recovered quickly and subsequently discharged. So those numbers of hospitalization have been reduced, and the ones that are in hospital now are very close to being discharged. No one, to my understanding from him, resulted in intubation and went on that slippery slope that we saw with the Delta variant. So that is a good example in Grand Bahama. Our hospital here, the Princess Margaret Hospital, is always been bombarded with large amount of cases. I would allow Dr. Forbes to say a few words about what we are seeing here in New Providence, particularly with the spike that we have seen in the last couple of days.
Good morning. So I'm honored to be able to give you a brief update in terms of what we are seeing in terms of hospitalizations and overall in terms of the COVID trends. So as you know, over the past few weeks, we had a significant reduction in the number of cases. There were many days that we had cases in the single digits and in the double digits, but we did see a spike in cases that we thought was attributed to travel. And notably, in Grand Bahama, they had a spike in cases. Now, there were some of those cases that had indeed traveled, and we were concerned that there was such a rapid increase in those cases that Omicron could indeed be present. In historical times, in the previous COVID waves, Grand Bahama always surges before New Providence, and so we are concerned when we see a tripling of cases in a number of days in New Providence and then indeed a double in the last 24 hours. As it relates to hospitalizations, they always lag behind new cases by a number of weeks, about 2 weeks. What we know about COVID is that in the second week of getting COVID, traditionally, people will have an inflammatory response, and so that's why hospitalizations are often a period of time, about a week or so after cases. And so it's a little too early to say if there is going to be a spike in hospitalizations associated with this current spike that we are seeing. In the last week, we had a very, very slight increase in hospitalizations, but not by very, very much. On average, the numbers had been about 9 cases a day. There's still about 10 or 12 cases a day. We're seeing a number of persons under investigation presenting to the healthcare system as well. And so it is a little bit too early to tell. As had been alluded to in the previous addresses, what we know about Omicron so far is that because of the large number of cases, hospitalizations can go up, although it appears that it could be milder than Delta. But we do have to be careful. The South Africa experience is not necessarily something that can be extrapolated to other populations. They had a younger population, a large percent of their population had COVID too, and so we are also being cautious and doing preparations for the worst case scenario and to prepare for Omicron in the hospital system and throughout the health system.
Any other questions for Dr. Forbes?
No?
Any other questions?
Yes, Dr. Darwell, the government has made adjustments in the past to protect family island communities as far as inter-island travel. Is that something that we could be headed towards or are considering at this point as we watch the numbers?
Yes, in our new rules, we have looked specifically at inter-island travel. I would allow Dr. Moxie to come and speak a little bit about what we plan to do and how that question is directly related to the amendments of the health services rules.
So, Keishla, thank you for the question. I think it's always important, we've learned through the many waves of COVID-19 that we need to protect all of our family islands. And so what you would see featured in the new rules is the provision for those islands that the ministry considers to be high burden islands, for persons traveling from those islands to produce a negative COVID-19 test, whether it's a real-time PCR test or rapid antigen test before boarding to go to another island. So that's one of the parameters we've put in place to ensure that, to the extent possible, we always know that there's a possibility that you can have a test done and the viral load just isn't high enough yet for the test to detect it. But to the extent possible, those are some of the measures we are seeking to put in place through the new rules.
there any change in protocols related to restaurants that are forthcoming?
Dr. Moxie again. Dr. Moxie will answer. I can, but I would prefer her to answer.
So again, we recognize that as we are different across the islands, we are also different in many other ways. And so we cannot treat the operations of restaurants the same on all islands. That said, one of the major changes you will see in the new gazetted rules is the provision for only those islands now that are reflected on the Schedule 2. Again, Schedule 2 reflects those high-burden islands. They will have additional restrictions. So some of those restrictions will be they could only for indoor operations. There's a limit on the number of persons that they can have inside. If you are not on the second schedule, then that indoor limitation does not apply to you. Again, you will have the requirement for being fully vaccinated or for producing a negative COVID-19 test, along with other measures. But again, the delineation here is that we cannot penalize all islands because we are seeing a national increase in COVID-19 cases. What the ministry now seeks to do is to delineate islands by high burden island or low burden island for COVID-19, and then through that process, apply those high burden islands to the Schedule 2 schedule. Thank you.
While trying to get elected to office was this notion of free testing. And you previously indicated that you would be introducing rapid antigen free testing. But given what we're seeing right now with these spiking cases, can we expect a rollout of free PCR testing?
Thank you. It's a good question. I did say before that we are finally at the request for proposal stages. Free testing without contact tracing and without a digital platform is like bread without butter. We are now in the final stages of awarding a contract for the digital platform that will be able to man our free testing ability throughout the Commonwealth of the Bahamas. Free testing is associated with rapid antigen tests, and there are instances where the rapid antigen test is not adequate, and those protocols are when the rapid the PCR test will be implemented, will be clearly outlined. A good example, we know that at our tertiary and clinics, individuals can present themselves to the clinic symptomatic or asymptomatic. And symptomatic individuals, we would definitely need a full diagnosis of whether the person is truly positive or the rapid antigen test is effective. I want to make it very clear. The scientific literature clearly outlines that the rapid antigen test is a screening test, whereas the RT-PCR test is a diagnostic test. It is important sometimes for the clinician to know if the individual is truly or make the diagnosis completely. And so our free testing modality will be a combination of both the rapid antigen tests as well as the RT-PCR tests. I would like to, first of all, thank the Prime Minister for his address and for outlining some of the plans that the ministry have in place for the implementation of free testing, as well as our plans to ride this particular wave and to do the best that we possibly can with the surges. We're preparing our tertiary facilities. We're looking at field hospitals. We are trying to improve and intend to improve our manpower resources. And with all this being done, along with new medication that will help to reduce the possibility of morbidity and mortality, we are moving in the right direction. And the details of our plan will be articulated fully to the Bahamian people and to the media early next week. We are analyzing the data. It's been 3 days. That data is being assessed. We're looking at hospital admissions. We're looking at how things are happening in our family islands. We're monitoring, and our rules will be adjusted based on the direction we see the Omicron virus and possibly the Delta virus with cases throughout the country. Thank you so much.
Lysol spray. But thank you, the entire health team, for your work and your commitment and always being able to guide us through these very uncertain and difficult times. We always want to end on a light note because it's the holidays, and we know that, while we have to take in all of this news, we still have to be able to, at some point, still enjoy life and do it responsibly. And of course, we've been highlighting our Bahamian businesses. And so before we close, we want to highlight 2 businesses today, the New Duff and the Curry Stop. So I'm going to invite Mr. Lazar Charlton and Patrice Delaney to come for the New Duff. And of course, Jamal and Shelby Bryce to come for the Curry Stop, so they can tell us about their products that our guests and our media personnel will have an opportunity to sample today. This looks like Lazar from the New Duff. Come, Lazar, and tell us about the New Duff.
1 second.
Hello, good morning, everyone. Season's greetings. Really? No? Yeah? All right. So my name is Lazar Di Lorenzo Charlton. I'm one of the co-owners of the New Duff. So today we have some of our menu line to sample for you guys. Just to let you guys know, we also have some samples from Belief Teas. We're partnered with Belief Teas at our store on West Bay Street. It's right next to Bahama Grill. We have some breakfast items. We have some breakfast sandwiches, pulled pork breakfast sandwiches, bacon breakfast sandwiches, and also just a plain one with egg and cheese for you vegetarians out there. And we also have some of our lunch items as well as some of our teas from Belief Teas. We have a lavender lemonade, and we also have a fevergrass ginger tea. So a little bit about our company. We started about 3 years ago. With myself and Kendrick Delaney, who most of you might know. He's unfortunately not here right now. He's off the island. And we basically pushed and hustled until we are what you see today. We hope to be a global company one day. Currently, we're operating out of our store, and we have a mobile unit as well that roves around the island. So we hope you guys enjoy today. We would love you guys to come and visit us on our at our location, on West Bay Street, and hopefully try some of our bulkier items. But we really hope that you guys enjoy, and we're really appreciative of this opportunity to come here and share some of our menu items with you guys.
Thank you.
Excellent.
And of course, from the Curry Stop, we have Jamal and Shelby Bryce to come and tell us about the Curry Stop.
Good morning.
Good day.
Good day. Happy holidays. So the Curry Stop, I'll just start real quickly on how we got started. Jamal always has a business venture he's looking to, and he brought to me, he said, Shelby, I want to start making roadies. Roadies? We're not Trinidad or, any Caribbean country. How can we make roadies? And he said, how about we put a little Bahamian twist to it? We'll add some Bahamian ingredients to it. And I'm like, oh, that's interesting. Sure. I said, how about we get some friends and family over and try it out and let's see what they think about it. And they came over, they loved it. And so I said, okay, we have $200. Let's make this work. And we started out with chicken, mutton, and seafood, and it was a hit, and people loved it. Eventually, we started with the grab and go. We started selling it at the gas stations, convenience stores, and so here we are. We started, our first customer was on the 28th of June at 10:31. And we were excited about that. 2018, sorry. And we started with mild and spicy. And so today we bought chicken, mutton, and seafood, mild and spicy, and we hope you enjoy it. We're currently closed for the season, but we hope to start again in January.
All right. Thank you.
Thank you.
Are going to enjoy the duff. They're going to enjoy the new duff and the curry stop today for the holidays. Colleagues, we will be able to set up another press conference once Prime Minister is out of quarantine to be able to take other questions that he will be able to address. He's looking forward to addressing your questions, particularly on the first 100 days in office. He's looking forward to that, so we will make sure that happens once he's back in office. But until then, Merry Christmas to all of you. We won't see you before Christmas again. And so, Merry Christmas to all of you, and please stay safe. Let's practice all the social protocols, during the holidays so that we can keep our numbers down and keep our travel advisory. If you didn't recognize, it's dropped another notch. We're at level 2, and so that's good for the country. So let's keep it going by all practicing and taking some social responsibility, personal responsibility for that. Thank you so much. Let's enjoy our businesses. Have a great day, everybody.